Hey guys, it's Medicosis Perfectionalis, where medicine makes perfect sense. Let's continue our anesthesiology playlist. In previous videos, we have talked about general anesthetics, regional anesthetics, and today it's time to talk about local anesthetics. We'll also review neuromuscular blockers. With that said, now let's get started. So in the good old days, which were not so good, doctors actually used to spit freaking coke into your wound, and that was the first local anesthetic. General anesthesia is not the same as analgesia, because analgesia means no pain. General anesthesia means no consciousness. Local anesthetics, of course, are anesthetics. They will make you numb. However, neuromuscular blockers are neither anesthetics nor analgesics. Anesthesia, care phases, pause and review, because we have talked about this before. Anesthesia is general, regional, or local. General is either inhaled or IV. Regional, neuraxial, limb, or others. Local, now we're talking about esters or amides. Other doofuses will call them amino esters and amino amides. Do you remember regional anesthesia that was discussed in the previous videos? Yup. What kind of agent did we use? A local anesthetic. In other words, local anesthetics can be used as a regional anesthetic or as a local anesthetic. Same medication, different approaches. What did we use here? A local anesthetic. What did we use here? Also a local anesthetic. Now, don't you want to learn more about local anesthetics? Anesthetic drugs, general or local? We're talking about the medications, not the approaches. How do general anesthetics work? They are pro-GABA, and GABA is inhibitory because it invites chloride into the nerve. Whenever you invite a negative into the nerve, the inside of the membrane will become more negative, which means inactivation, #hyperpolarization. Local anesthetics, on the other hand, work by inhibiting the sodium channels, not stimulating, no, inhibiting sodium channels. And when the positive cannot enter, the inside of the membrane will become more negative, #hyperpolarization, #inactivation. We're trying to inactivate your nerves. The action potential is here. Do you remember the rapid depolarization? Yeah, who was responsible for that? Sodium entry to the cell, sodium influx. Who's gonna inhibit sodium influx? Yup, local anesthetics. How do they work? They inhibit the voltage-gated sodium channel, which inhibits the conduction of the action potential, and this happens through 3 steps. First of all, local anesthetics, they cross the cell membrane. Alright, so in order to cross a membrane, you have to be lipid soluble, in other words, non-ionized. And of course, you know from pharmacology,